An alarming number to tell you about right now. The homeless are dying at a 10 times higher rate than the rest of the population here in Utah.
That's according to a new report from the Department of Health and Human Services. ABC4's Jordan Tracy is live here at the state capitol with more on this report. Jordan, I know you told us there's a seemingly glaring gap in their data.
Yeah, that's right, Sarah. Today we learned that the study didn't actually talk to any of the unhoused population, boots on the ground, to get that first-person account for the health services that they believe they need. But what the study did cover, and what we do know, is that this is the first report of its kind in the state of Utah, and DHHS believes that they are the only second state to do this type of study. The report is providing some color into the cause of the higher death rate to potentially inform a course of action on the policy level. Now, the report says the average age of death for someone who is unhoused is 56 years old. That's compared to the rest of the population at 72 years old. The main causes they found were due to chronic illness like heart disease and diabetes, all the way to drug-related deaths.
It's a limitation of our report. We didn't have many boots on the ground talking to actual people who are experiencing homelessness. We partnered with our COCs in the state, with 4th Street Clinic, with the Office of Homeless Services, but our research team wasn't on the street. We were looking mostly at our vital records and statistics data.
Now, some of the solutions they proposed in this report include increase of housing access and as well as health care access. Those aren't new ideas, of course. They also want to increase harm reduction resources and getting all of the health care providers together in the same place by creating some sort of advisory board. That includes UHC, Medicare, Medicaid. That way that they can talk about access to primary care, because that access could make a difference. While there's clinics in the state, they see that the unhoused are usually going to the ER, and normally only when there is some type of emergency and not for that primary care to keep up with those chronic illnesses that we're seeing as the main cause of death. Live at the state capitol, Jordan Tracy, ABC4 News.